Adenovirus is a new menace in Bengal where most of the children are getting affected, and there are reports that some of the children are dying also. We have with us today one of very renowned pediatrician of Bengal, Dr. Ognimita, and we'll talk to her to find out that what is actually the scene and what's happening. Madam, tell us that what is this virus and how many children on an average you all are getting now?
Actually, this adenovirus, it occurs every year during this season change, and there are certain other virus which cause this respiratory illness in the children. There are influenza virus, para-influenza virus, RSV, respiratory syncytial virus, which affects below 2 years mainly, and also there is rhinovirus and this adenovirus. But this year the adenovirus has take a turn and the picture is a little different, and it has become very severe. It is affecting all the age groups, but it's more fatal below 2 years. So we all the parents and everyone around the baby should be very careful, because we all can transmit the disease to the young children. And the problem is that the babies, they are now getting this illness, and the symptoms are same like flu-like illness. They are suffering from high fever. The temperature can rise up to 103-4 degrees centigrade, associated with cough and common cold, and then it is increasing to respiratory distress, and the parents, they are very much shocked to see that the baby is collapsing suddenly. And sometimes this is also associated with diarrhea, vomiting and dehydration. So when the babies are brought, especially from very far away places, when they are brought, they are already collapsed, and their condition is poor, the general condition is poor. So we all want to alert the parents that they should be alert when the child is contracted with fever and cough and cold. They should immediately contact the hospital or the doctors nearby. And
What is the stage of bringing the children to hospital, child to hospital?
the parents should be alert that when the child is having mild fever, then they should treat the children with paracetamol and oral dehydration solution to prevent dehydration, because in this disease the dehydration sets in very early, and the baby can collapse due to dehydration. So they have to maintain the hydration, give paracetamol in adequate doses, and observe the child whether the baby is having fast breathing, because usually below 2 months the breathing rate is around 60, so it shouldn't cross 60. From 2 months to 1 year it should be less than 50, it shouldn't cross 50.
And how will they see it?
Yeah, they should observe because it's very not easy for them to count the respiratory rate. What they should see that whether the tummy is going up and down very fast, and usually the parents, they seeing this, they can report to the doctors that their tummy is going fast, associated with a suction and indrawing of the chest, because the muscles in between the ribs and the muscle just below the rib, lowest rib, that is the upper part of the tummy, it goes inside and it's indrawn. So when they see this suction, they can immediately report that and they should know that when there is suction, the baby is having a respiratory difficulty, great difficulty, and that baby immediately needs oxygen and nebulization. So most of the children, when they are coming in this at this stage, we actually want to guide the parents that you should be alert that the baby is breathing fast, the fever is high, and he is lethargic, weak, feeling little bit sleepy, not taking food adequately, passing less urine what he should. So they should bring the child at that point of time when they see that the illness, they can't control the illness, and the fever is not going down, and the respiratory rate is high, the baby breathing fast. So if they can bring at that point of time, we can give support to the babies better, and the outcome is also better, because when they are bringing the baby collapse, then the baby may require ventilators, PICU, and then the treatment becomes more complicated.
How can one stop it? Like corona, we used to wear mask and all. What in case of adenovirus? How one can stop this?
Prevention is always better than cure. So for preventing this illness, hand sanitization is required because usually the babies put their fingers into the mouth, nose and eyes, and there is contamination. So from one baby to one another, the contamination is very easy. So the baby should be having sanitization of the hands at regular intervals, associated with social distancing, because if you are allow the child to play with the others, so if one is suffering from illness, that boy should be that girl should be prevented from playing with the others, because it not only contaminates the disease to the others, but also the baby requires
Do
observation.
you think the school should come up with directions now? This is a high time.
Definitely, I think that the school should have the guidelines, whether they should allow if the baby is ill, suffering from fever, cough and cold, whether the baby is coughing, they should be immediately sent back to home, and that baby should be kept under observation, and they should be also monitored whether they are having.
What percentage of increase of such patients has taken place in last 15 days? Say?
Actually, the disease is rising from the end of December. January we are seeing this, and also in the February. So the prevalence of the disease has become high, because with the old and new cases is higher than the previous years, and mostly because it's affected by the adenovirus. It's not that the other virus are becoming so fatal, but with adenovirus the babies, they are developing also chronic lung disease, which have a long term consequences, because once inhalers is started, if we are stopping the inhaler, we have seen that the babies, they are again coming with the same
So
symptom.
what would be your message for the parents?
They should be very much careful, and if they are also suffering from respiratory tract infection or flu-like illness, they should be sanitizing themselves, keeping a distance with the baby, and also use mask at home if they are coughing and sneezing, because this virus actually gets from one person to other person through droplet nucleus. So they should be very careful.
So it's really a very concerning situation, and that's why she feels that the schools should also come up with guidelines on this, and immediately when some children, they are caught with cough and cold and fever, if things are not right, the parents should contact the doctor and should come to the hospital. This is Komalika Sengupta with Anshuman Roy reporting for CNN News 18 from Kolkata.